I just have a couple of questions to jumpstart us, and I think the first question is, aside from Heidi and Moore, who were expected to be here as part of the task force, I'm wondering for you three, sort of what brought you here today? Why was it important for you to be here? John, I don't know if you want to start or pass the mic.
Thanks for the question, Brandon. Thanks everybody for giving me and us the time. It's good to be in this forum, at least for me, for the first time. Aging and disability services as a policy administration, as a policy area, program area, became kind of a new part of my portfolio in February. So I'm newer to this particular policy lane in Minnesota, I should say. I've worked in other places in other states and done work on long-term services and supports in particular, but certainly new to this group, this forum, and so I'm just glad to be here and appreciate again the engagement and the time. I think the reason that I felt it important to be here is really threefold. I think first, this is a really important transformation change that, of course, I think carries with it a lot of anxiety and concern. So I just want to name that this is a big change for all of us, but most importantly for the people who are program members and people receiving services. And so I feel it's important to show up in person, to look you all in the face and just to acknowledge the importance of this, to demonstrate that it's important to me, to us. And we are here to authentically have a conversation with you. And so that leads me to point two, which is we know that we could have done this better. Say it again, we could have done this better. This is a 7-year project that I understand, and again, I'm newer to this policy lane here in Minnesota. I've been in DHS for 2.5 years, but know that there are frustrations. There's not an excess of trust here. And so we want to acknowledge that and understand that, acknowledge that there were missteps, that there could have been co-creation and engagement over the 7-year history of this initiative, that it could have been better. We can't obviously go back and change that now, but we're here with you today and going forward. And there are some realities that we can't change, but we are here to work with you to the extent that we can going forward to make things as good as we can be and to do the work with you to rebuild trust to the extent that that's possible. We are committed to that. And that part of that is just listening again to where we can do better and where we can work together to build together. So I just, I want to say that. So, and I think the third point that I was going to make really is also, there's a long road ahead of us too. I realize 7 years has been a long journey, but there's a lot in front of us too. And so we still have a lot to do together, and we just hope to do it in a better, more partnered fashion and with, authentic engagement and co-creation. And that's the spirit in which I'm showing up here humbly. And again, want to hear from the task force, from folks here about, how we can work better together. So, and I guess I'll stop there. Others? Okay.
Hey everyone, ditto to everything.
Introduce yourself again so people remember.
Sure. Hi, I'm Christy Grom and I'm the Director of Legislative Relations at DHS. Ditto to everything John said, really agree with those remarks in terms of how I'm showing up today as well. I think one thing that I would add from my perspective is Elise and I spend a lot of time at the legislature, and it is both a privilege and a responsibility, a big one, to be in those conversations, to be close to that nexus of power, to be there at the end of session when decisions are being made that impact people's lives incredibly personally. And one of the things we always talk about as a team is making sure that we're bringing people into the discussion, because it's really easy for all of us, legislators, those of us from department staff, to get swept up in the politics and, egos and power battles. And that's really not why we're all here doing this work. So we have to constantly remind ourselves that what we're doing right now impacts people, and we need to understand how the policies that we endorse change people's lives for the better or for the worse. So, you know, we've probably talked today a little bit more about some of the discussions that we've had behind closed doors about Waiver Reimagine. And I really want to, make sure that I'm in this space to hear you all out about, you know, what your concerns are, what we can do to make things better. We did try to do some things to make things better last session, but I know that, you know, there's still a lot of concerns out there. So I really hope to get that feedback from you, that honest feedback. I want to hear it, even if it's hard to hear. And then lastly, I would just say we spend so much time at the legislature in like conflict-ridden spaces. And it's refreshing, and it really gives me energy to be in community with all of you, even having hard discussions. So really excited to hear your questions and to share what I can here today and hopefully going forward.
I just want to interrupt please on something that Christy said, and Christy, I hear you when you say like get the feedback, and I know that you're sincere with that. I will let you know from a time management perspective, I'm going to encourage the task force to focus on what they want to understand better and learn from you all, and that if there's comments and feedback, we will create tons of opportunities for that, including the general comments over there. But I don't want to squander our precious time in understanding your perspective by giving feedback. We've got other ways for that.
Hi, everyone. Lisa Bailey. I serve as a budget director at the Department of Human Services. And my primary goal is to, you know, assist the agency in putting together the governor's budget recommendations, and then work with Christy and her team alongside them throughout legislative session and working with leaders and legislators in, you know, passing the final bill throughout session. I have been at DHS for 12 years, and I come to this space as someone who really wants to change people's lives. That's why I work in this space. I'm a mom, I have 4 kids, I have a few kids with disabilities. And so I come to this space really passionate about the work, and I have many, many, many sleepless nights about decisions that need to be made, or sustainability of spending on the programs and things like that. So I bring myself to this work with a very serious lens on ensuring that people thrive in their lives. And so I just want to kind of share that this work is personal to me. And I feel honored to be here.
So good to hear. I want to give Heidi more. Do you want to add anything to what I just said? You don't have to, but.
Yeah, I will. Good morning. Oh, I've turned.
Just hit the button.
All right. Good morning. So I have Mac on. Let me know if you can't hear me well, because my kids say, Mom, you need to do a better job at enunciation. And I should karaoke because that's helping. That will help me. So with a mask, it might be a little bit harder. And I have the mask on because I got hit something over the weekend, and I'm recovering, but not 100%. And I know with the holidays, I want you to all be able to spend time with your loved one. And so trying to contain whatever I have, not give it to you. I am Morlu, currently serving as the interim assistant commissioner for Aging and Disability Services Administration at DHS, as the administration that are tasked to really implement Waiver Reimagines. And I have been at the state about a little bit over 7 years. So when I came in, Waiver Reimagine was it was in that initial phase of talking and exploring, and I was serving in different capacity and different roles at DHS, but now with my current role and where I see and where I sit, Waiver Reimagine have evolved a lot, right, through the 7 years that we've been implemented. And I know that it's hard. This is a big transformation. We're trying to improve our system. And I know it's hard, and I'm scared. I am scared because I also have family members that are using this, you know, using this program. I have been just through my both with similar to Elise, have personal experience and also professional experience. I worked as a direct support professional, as a PCA, as a in-home provider, case manager. So I have seen from every side of at the table of what our programs and services do to people. And then also for me, just to bring in a different perspective, different lens of navigating our system. I hear this again and again, I'm gonna say it again. The word is complex, right? Our system is very complex to navigate. This is the moment we're trying to transform to something simpler. It's gonna take a lot of time. It's gonna take a lot of courage. It's different, so it's scary, but I have not been in a place where I feel so hopeful. As much as I'm scared, I'm also very hopeful because we're turning something new, and hoping that we can create something better for all of us, for the people that are really, just people receiving services. So I'm gonna just pause it here and also, yeah.
Heidi, I'm gonna ask you all as panelists to sort of bottom line your points, so that we can get as many questions in, because I wanna make sure we do that. Are you gonna, do you wanna, yeah, do it?
I'm Heidi Hamilton, Director of Disability Services Division. I know many of the people in the room. I've been in the disability space at DHS for over 20 years and have come back to the Disability Services Division in the past 3 years as the director, and coming in to see how Wave Reimagined was working. I completely agree with John that there were definitely things that we could have done differently to engage the community and plan with the community. This is a really wonderful opportunity to fix some things that have been wrong with our system for a really long time. And I hope that we can get to a place where we can work together and partner together to fix something.
All right, well, I'm gonna hold you to that right now. And you all don't know, but I have the agreement of the body to speak in candor, and for some of you probably already know, I'm my mother's daughter. You all say you want to improve the system, and there's a whole bunch of people in this room who don't see the system as a problem and feel like you're actually creating a problem. So what is going to be different in a positive way? Like, how are we in such different places on this? So let's just get a couple of voices that can speak to that. Heidi, I don't know if that's you or if you want to pass the microphone to somebody else.
I can start. So one thing that I have a vision for Waiver Reimagined the Fixing is there are 87 different counties. There are a couple tribes that are managing our waiver programs currently. They have an aggregate pool of money and they decide how resources are divided for the people that are receiving waiver services. And so that's 87 plus different ways to do that. A person can be living in one part of the state and have a certain benefit package. And then they move to another part of the state and it looks completely different. They have to fight for the things that they were easily getting in the other county. And in terms of the resources that are available to each person, with Waiver Reimagined, that will be consistent across the state. So we will have that individualized budget methodology. So that's one thing that I think is really important and has been an issue for a long time.
Is that what you all think of in DHS when you use the term equity?
Yes.
Is that the only thing you think of when you use the term equity?
I will, just from my perspective, personal perspective from a person of color, I think when I think about equity, I think about who's accessing the service. It's not just about who, but it's about how, and then it's about what do you get from, like, so who, how, and what, it's all very depend on the person, right? And so for me, equity is if we move into when we move into this individualized budget where it's transparent, it doesn't matter where you live, to Heidi's point, where you live in the state, you'll be able to see what your assessed need, and then that budget, so that it can help you plan your support, your service. So to me, it's more than just the individualized budget, but it's also about how we go about doing our business and helping people really accessing the service and the support.
John, go for it. That's fine. Anybody else that wants to be on this, but when we come back, there's a couple of elephants in the room that I want to address from you.
Okay, so I'll just lean on the equity point for a second here. I think two things. The principle of equity to me is that people who have been marginalized, people who have experienced injustice, have the resources appropriate to advance them to a place of justice. That equity is actions to remove injustice, right? And so when you have a system where there isn't transparency, where there is inconsistency, that does create the opportunity for variation based on resources or different levels of advantage or justice or marginalization. And so for people with disabilities, we want to make sure that we're doing things in a way that facilitates equity, that increases equity, and not in a way that is inconsistent, that is secret, that is opaque. And so I think that is the way that we, through this, will try to build equity. But of course, I'm just saying the thoughts in response to Fran's question and what I've heard from my colleagues here. We also need to build that understanding together, and you all may have perspective about this that will inform how we see equity, how we build equity in our programs, and for the people who receive the services that are impacted here, and for the people ultimately themselves. So that's kind of my thinking.
Please.
Okay.
I just wanted to add one thing related to what you're saying, John, and, trying to co-create this going forward. When I think about policy decisions around equity, one of the parallel-ish examples I think of is the Sentencing Guidelines Commission. And years ago, they came together and they said, this is going to be a way that we can make sure that when a judge has, a defendant before them, and no matter what color they are, where they're from, the crime is this is how they're going to be sentenced. And they had this very methodical rubric of how they were going to make sure that sentences didn't disproportionately impact, in particular, Black men. And, I think it made improvements, but actually years later, we've seen that there's still disparities in the system. And so I highlight that example because I don't think we think that the individualized budgets is a panacea. I think that there will still need to be ongoing continued work to make sure that we are making the system truly equitable.
Perfect. I'll leave you, just so you can have a facilitator brain. I'm thinking we have a conversation for about 10 minutes with a couple of questions, and then I want to get questions from the body, and I know you have to. So, John, you said this in your first sentence, and so it's very much an elephant in the room. You said there are certain things that are not going to change. What are those things?
So I will name a couple of things, and I don't know every dynamic or nut and bolt of this set of policies, but I will tell you in transparency, again, the things that I understand that are at this point immutable. And I think the first of which is the timeline. So the January 1st, 2027 timeline is something we just can't move from. It is in statute. It is a clear expectation, I think, of policymakers who wrote and created the statute. So I think that's the first thing. In addition, we are moving toward an individualized budget. So that is, and we kind of talked about some of the reasons for that. Glad, of course, to have more conversation about that with you all. The third is we're moving from 4 waivers to 2. The effort here is again toward simplification, toward transparency and streamlining. Many of our programs, I will venture to say, and I'm not sure how, I don't know how others here on the panel field that I will just say are overly complicated. And that is difficult for providers, it's difficult for people receiving the services, it's difficult for loved ones and family
I'm
members.
gonna interrupt on that, and just go over the list, John, I'm just gonna ask people, you don't have to justify it, there's been enough conversation here.
Very good,
And they're not gonna necessarily agree, but we know we don't have to agree, we have to understand.
understood. So I think those are the major features that I would list.
Okay, I got a list.
Okay,
Let's just make sure, if they are movable, right, if they're not do the list. Okay. So you mentioned the goal live date. You mentioned the two waivers. You mentioned individual ed credits. What about the use of mid-choices as an exception?
initially, we need to use that because technically there's no other option at this moment.
But it may change, it might change in the future?
Absolutely.
Okay. How about the people are going to be transitioned on a rolling calendar over the course of a year?
I'm gonna have to call a lifeline on that one.
Here's your lifeline.
Yes, that is how we need to, in order to roll that date, that is how we need to.
Okay, so this is informing that. And then, has financial savings been added to this?
That is a very important feature of this, in that we have to slow the rate of growth.
Use real words on that.
So when I'm being very specific in my language because we're not trying to cut necessarily. We're trying to slow the rate of increase in the spending year over year. I know that sounds technical, but I want to be precise.
Nope, I told them.
Yeah, I'd say it differently.
Okay,
Sorry.
all right. I'll defer.
I'd say it differently. When this was first introduced, it was as close to budget neutral as possible. The intention was not that it was a savings item. The intention was to basically have a more equitable distribution of resources. And that was about as close to zero as it could be at that time. But that meant it was slightly below,
That was 2017.
I believe, yeah. 2017, 2018, it might have been a March year. 2019, there were two phases of this. So it was slightly below zero, which means it was a savings. Now, many years later, as you get closer to the date, that savings grows with the forecast. So it's about 1.5%. Fran, you may know, I think I gave you the number. It's about that. But the intention wasn't to slow the growth at that time. At the time was to have a formula that people could be in the driver's seat and they would know what their budget is. And that was the net impact in the proposal at that time. Now, we are in a different place as a state budget where the taxes that fund all of the services are coming in at a lower amount than the expenditures or the spending that the state has. And that's a separate problem. It's not immersed in this project, but it is a elephant in the room as well, because we don't have the ability to say, oh, let's not hold the savings anymore. We have to hit that due to the state budget issues.
So there's been an added constraint on this process because of what we've seen in the greater economic environment. Is that fair?
That's fair, yeah.
So, and maybe this is going, maybe this is going to be out. Like Christie. Christie, I think there's a perspective among some of the stakeholders here that what was envisioned in waiver reimagined sort of legislatively is not what is currently in legislation or being asked to be done. Speak to that, you're nodding, so I don't know if you agree or disagree, but just put your perspective on that.
Yeah.
I'm sorry, I keep turning.
Good practice. Yes, I think that's right. Fran, and I've heard from some of you, and I've also heard actually from a representative just late last night about an issue particularly around the way this task force was drafted. I think that might be what you're referring to, Fran, where we're implementing waiver reimagined before the report for this task force is due. And, you know, as John mentioned, there's some immovable timelines and benchmarks here. One of them is that we need to submit to get all of this done. We need to submit our waiver amendments to CMS, I believe by March of 2026. Tell me if I'm wrong, experts up here. And that feels and is like, well, then what is the advisory council and task force? What are you advising on? And so I understand that feeling, and regrettably, I wish that we could have changed the timelines here, frankly. The House last session, Elise and I advocated behind the scenes actually to delay waiver reimagine by 6 months. And that was in the Chair Noor's position. And we didn't have any issues with that personally. We thought that that would be time for the task force to have an input, but also for people to better prepare for individualized budgets. And unfortunately, throughout the course of negotiations at the end of session, that came out of the spreadsheet. And it had a cost to delay it, as Elise has mentioned. So that was part of the reason that that came out. Now, things were so chaotic at the end of session that I think people weren't necessarily tracking. If that 6 months delay wasn't in there, then what is the timeline for this task force and how is it going to be possible that you all actually have time to an opportunity to provide meaningful input? So that wasn't the intent, but that is how it played out.
Yeah, so I'm just gonna like foreshadow a conversation in the afternoon. I'm gonna be proposing to the task force that they consider submitting a preliminary report early while there can still be time to make a change. So just because it said, that was a deadline, that was not the date. So I just want to let people know so that they don't waste a question on that, but they do that. Okay. Let's open the floor and have people start to, Matt, I'm gonna ask folks in virtual space to start, putting their questions in chat and you can screen them. If you are all okay, I want to give the floor to Dr. Kate first, because then she came with a couple of questions. And, I want to make sure that everybody's got a voice here.
Sure.
At Tuesday's meeting with HRS, it was stated that there was no given the very high support needs, that there will need to be an exception process for those individuals. Since those with high support needs will have higher costs associated with their care. How do you plan on addressing this disparity, since there seems to be no proposed process or an exception process? Not for addressing the potential for exceeding total budget alignment for waivers, especially with upcoming budget deficits for the state of Minnesota.
Thank you, Dr. Kate. I just want to double check. I believe drafting an exception process is one of the tasks on the task force. But go to Dr. Kate's question.
Yeah, we will still need to be working, you all to develop what an exception process looks like. I don't believe that level of detail is needed in the submission to CMS in March, but it is something that we'll have to continue to work through this group.
I would also add that, just so folks know, it's not an afterthought. It was always known that we would exception. It was always known that some people would have needs that cannot be met with any modeling. And that to have no exception would be unacceptable. So it was always in the plan, it was always in the numbers that we've developed. So I just wanted to make that clear, that it isn't, oh, we didn't think of this, like, it was thought of from the very beginning, that there will be some people that need an exception, and that is absolutely something we needed to do.
Perfect.
Yeah,
Let me-
that's
let me-
important.
let-
The term exception makes it sound like, oh, we didn't think about it, but that's a very good point.
Okay, I see hands. Don't lose your thought. We're going to come to it. I want to go to the virtual space so we don't have primacy here. Matt, what are you seeing in the chat and what's a question?
I've got a great question here. How do we think budget targets and the whole issue of fraud plays into this task force?
Okay, so just so people to know, the folks on the panel are looking at each other.
Yeah.
And I think they're trying to figure out who's gonna address this,
I can
so.
do it.
Hold it really close, it's not as normal.
Okay. This is a good question, and what I will say is it feels overly simplistic to say they are entirely independent things, but the work, the Way to Reimagine Task Force and the implementation of Way to Reimagine, it is not about fraud. That said, there are actions happening right now with respect to specifically providers that are in relationship to. And so there is an interaction in that regard. And so what I would say is, I would love to hear from you all, based on the actions that we have taken so far, and based on the impacts, what interactions we want to highlight for us to be mindful about. But to the extent that we are here to talk about designing programs and services that better serve people, that is the goal. And understanding we have different perspectives, or there may be different perspectives in the room about that. We are not here to address fraud, but as it very straightforwardly and practically impacts our work and how this rolls out, we should talk about it.
So I want to let people know that as I'm listening to the panel here, I'm putting on a flip chart some of the things that fall into things the task force should pay attention to. One is the exception process, the other is related to fraud. If there are things that bubble up, let's make sure we carry those forward. We're all interested in doing away with that.
I thought that Chris, then Trisha, then Julie. Okay, oh, you tell me. When people have a question, they can tilt their thing up and I'll know that.
So, okay, but I'm gonna go in between the virtual space, so we don't have privacy here.
I've not seen anything else.
Hi, my name is Chris. I'm a parent. So disabilities. So we talked about some givens before some of you were in the room, and some of us have stated some of those givens are, it kind of feels like an us against them. There's probably not been a level of trust that we've all developed, and I think that's fair. I don't know you, you don't know me. Some of those generalities are, some of you who have a job within DHS get to take your shoes off at night. Some of us are running a marathon every single day, day in and day out. And some of those marathons just look different. So my marathon looks different than Fran's or Trisha's or Dr. Kate's, but they're different. What I guess I'm trying to get at is that when we're all having these different experiences, how do we get to the point of when we know better, we do better? I hear you say, we know we could have done this better. At what point do we say we should probably do better? The other example you had asked about was when we identify areas of fraud. And I will challenge this, and I'm not going to look the person directly in the eye. I have sent communications to people that are sitting in the front of this room where I have personally identified fraud, abuse, and waste. Not only abuse of funds, but abuse of the client. And when I get a response from my email that's over 6 weeks old, I would be happy to reach out to you and let you know that they responded, but they haven't responded yet. So that tells me it's not important to you. Not specifically you, I'm just making eye contact, we've never met. But those are some concerns that I have. I would think that others are sharing that. I'm struggling with when we know better, we do better.
So I want to make sure that going through my facilitator brain, what I hear is there's going to be an opportunity for us to somehow collectively build a process that if we're really rooting out fraud, how to be able to report it and how to be actionable and not feel like it goes into a black hole. But I think the thing that I'm really hearing related to the task force is, okay, if you say we want to do better and we can't get on the Einstein Express and redo it all, what's going to be different going forward? Is that fair?
It's kind of this is the beast that we know. This is the, and I hate to say it this way, but it's almost an abusive relationship that we've become accustomed to. We understand it, we know how to navigate it. And so now it feels as if we're being asked to step into a new abusive relationship where we don't know where the punches are coming. I know what it does now.
So what's the question? I'm going to ask you to be really clear. What is the question you would like them to answer?
How can we make actions to make this a positive process forward where none of us actually die?
And are you talking about the task force process or the way we're reimagining?
Yes.
Okay, so 2 questions. The first is, what's going to be different in working with the task force so that we can make progress together? And the second, it relates to how we're going to make sure we have safeguards in place. And I would argue safeguards that are perhaps informed by this body to make sure that any things that were not visible to us, I don't want to say blind spot and be ableist, but what are the things that we're not seeing? And how do we make sure we're working in step to catch them? I don't know who's catching the mic.
I can start. So first of all, thanks for the candid feedback. You're right, we don't know each other, but I would like to get to know you. And I think one of the ways that I will just try to do better is be present, have a conversation with you and try to do better. And however you define that, I don't know what that means. I'm just being authentic right now. I don't know what you want from me or us, but I'm willing to listen and learn and try to do better in the ways that you're presenting it.
I don't mean you personally, I mean the system.
Yeah.
Yeah,
Sorry, I don't.
No, that's-
You were doing a fantastic job.
you don't know. You can say I'm not, that's.
No worries.
I'm great, that's great. We get that from time to time.
Yes.
So that's fine, that's part of the gig. And then, sorry, I lost the second. So how do we do better, as a town? Oh, and how do we make sure that that people don't die as a result of this? And again, I would love to have conversations about how we do better as a system such that that doesn't happen, whether it's defining an exception process, whether it's thinking through within the immutable things, or the things we can change in the future, how we prevent that, because, I don't want to speak for everybody on the panel, but that is something none of us wants. And so, if we are not paying attention to things that will help us prevent that horrible outcome, and actually help people to thrive in their communities, that's our goal. I'm here to listen, and so we'll do our best to build that space.
I'm going to go to the virtual floor, but I want to just sort of have a little bit of a teachable moment here. One of the things I know is that often when teams and processes get in the weeds, it's because they were unclarified and unagreed upon expectations of different parties that never got surfaced. And everybody thinks they're doing their best work, but we never daylit what the expectations were. So I want to be careful. I want to honor Chris's question, but I also want to be careful that this body may have expectations of you that you can't agree to. That's okay for people to have expectations, and you might have to say, I will yellow like that. I hear it and we will try, but I can't guarantee it. There may be other expectations like, yeah, I can read like that. There may be other things that are red. And to me, the most important thing for us collectively moving forward is that we know what those things are. We may be disappointed, but don't just tell me things you think I want to hear in order to shut me up, because that's what's eroding trust in a lot of ways. So that's, sorry, I'll get off my soapbox there. Virtual space, Matt, what do you have?
Yeah, I've got a great question and some insight attached to it. Can the state run numbers of how many individuals have needs that were not met due to the lack of service providers? And here's additional insight. Their budget is way lower as the lead agency will remove that service from their agreement if a provider is not found. I am worried if we are looking at ways to lower expenses when we are not even meeting all the needs of individuals out there. There should be one model that goes around individual needs. And again, the original question, can the state run numbers of how many individuals have needs that were not met due to the lack of service providers?
I can take that. So we've looked at this in the past. That's a really great question. I think the challenge we have is twofold. One, on average, every time we've run the numbers, and it's been pretty static throughout many, many, many years. On average, people use about 80% of what's authorized of them. So we pay claims about 80% of the dollars that the county authorizes. We've tracked that over time, as I said, to see if there's trends that we can see or different, modeling we can do to see where there's issues there, and it's been pretty consistent. So it's hard to tell, is the reason the person is the reason they can't find a provider? Is it the reason that the county authorizes X number of units knowing that, they'll actually need to bill less just to make sure there's enough services in their service plan, so there's not a stoppage. So at the state level, it's really hard to know the reasons. The other thing I would say is we don't know beyond what's not put in the service plan, right? A person could have needs that the county doesn't authorize because they hadn't ever even found a provider at the very beginning. And so there is no data that the state can track in terms of, what is a person's needs and are they being met if we don't have like the starting point.
Let me make sure I understand what you're saying there. So if I lived in a rural county, let's say, and home health care did not service my particular road or wherever I lived, you would know that even though I needed services, that wasn't happening because basically it's invisible to you.
That's correct, yeah, yeah. We have done analysis in terms of like system-wide, like where are the gaps? Crisis respite was one several years ago. So we do try to understand at large, where are there gaps in services that we need to pay attention to in terms of policy solutions. But on a finite level, we do not know.
Trisha, I know that your hand, but I also, folks, I haven't heard from, there was another.
Process issue is huge.
What was that?
It's a process issue.
Oh, which-
I can't keep jumping around to different topics. I can't follow, and I don't know if everybody is having that problem. But can we put like so many minutes or put a topic to bed before we ask new questions?
We will do our best. I'm concerned about getting the questions that are more pressing. Katie, were you going to say something?
Yeah, I was just gonna acknowledge, I think, and maybe Linda, what you're referring to is that, there's some, people want to make some counterpoints to some of this discussion. So I would say for the time that we have to capture those, this cannot be the place where we resolve all the questions.
No, but to ask an additional question.
Right, we want to hear from as many, yeah.
Or a question that wasn't answered at all.
And write your questions down, get them to us. Would you all come back again? Can we do this again? And get those people to come back again? Okay,
Yeah.
all right. So let's make that a part of our. Jeff?
And then sorry, I'm gonna have to speak for Jenna and with Jenna.
Yeah.
And you are?
I'm Cindy, I'm Jenna's mother, and I'm helping her. John, especially to you, you talked about equities being so important, and I think a couple others did. And what we've seen in the tables that we've gotten is that you get a lot more resources if you're in a provider situation than you would get in a home or own home situation. And that's not equity. That's not fair. And then the other part of it is you talked about injustice. And injustice is more than the things we've talked about. To me, it's an injustice because of a big budget cut that Joe would have to go in an institution and group home, and not be able to live the life she wants to live and that we provided for her. And to me, that's the biggest injustice of this whole thing. Yeah.
Yeah, I just want to speak to the budgets and why they're different when you live in a residential setting versus your own home. Currently, that is how much we're spending. Currently, when you look at how much does a service plan cost for a person living in a community residential setting versus how much is the average service plan for a person living in their own home. Residential settings cost about 75% more on average than a person living in their own home. And so that is the status quo. That is when you look at the aggregate budget. So when we calculate the budgets, we actually are weighing more on the person living in their own home compared to what we're spending right now.
I want to, Katie, can you remind me, I want to put it up on the board, but I don't want to do it right now. I think we want to make sure we're all using the same term. I hear a difference between equity and equality. And I think there's a nuanced difference in that we may at some point need to come back around to. Let me go to the virtual space. Matt, you have a question? You're muted, my friend.
Pardon me, I was on mute. We had one follow-up to a previous question, but I think we can move forward.
Okay, let's take it.
Couple points.
Okay, we got it.
Trade planner. I am a self advocate parent for participants, waiver participants. I have concerns about using expenditure tracking. This is not a federally compliant method to design waivers. There are additional federally required mechanisms that need to be followed. Homestead, participant satisfaction, meeting needs. Meeting needs cannot be based off of suppressed utilization post-COVID. CDCS unbundling, leading to limited service availability and access barriers. We cannot design something based on suppressed utilization and access barriers. What we're tracking here are shortages and not needs. That's the first one. The second question I have.
What was the question though? I heard a statement. What's your question?
I'm wondering how we're going to meet federally required tracking.
Okay, so it's somebody can land this because I'm going to forget it. So what's the rationale behind the calculations and meeting that? Okay, that's the first question. Second question?
The second question is, can DHS identify the specific statutory provision that authorizes individualized budgets to vary based on residential setting rather than being based solely on individual need?
Which was
And if no such provision exists, on what legal authority was the current budget structure designed?
which is one of the other hot topics sort of concerned in this space. So is anybody put to speak to this?
To be frank, I'd have to pull up the statute and reread it, but.
I would have to look at the statutes again as well. And I would say in the waiver area, there's a lot of, even on, how, there's nothing in law right now that says how counties base the budgets that they do calculate at all. So that is status quo, that there is no legal requirement in law for how counties need to calculate their budgets. But certainly we can be happy to work with you if you would like to add more clarity in statute. Or in the waiver plans that we submit to CMS, if there's opportunities there for you to review those. I think the other question was about homestead perhaps, or.
I did want to get the question. So you're saying we, task force would work with you in terms of defining what? I want Katie's capturing it, so I don't present.
Yeah, so we work with, advocates, legislators, lobbyists on technical assistance. So if someone has an idea for something you want to put into law, our legislative and budget team will work with members of the community to draft, and legislators usually to draft that idea, even if it's something we don't agree with. But we do it in the spirit of what is the goal and what would be compliant with federal and state law to move that forward.
Thanks, Katie. And the other question that I asked, but I didn't hear, because I didn't understand.
So I hear what you're saying. Absolutely, we need to comply with the homestead plan requirements, HCBS settings, rural requirements that we have to comply with. And there are other federal requirements. To Elisa's earlier point, there is a historic imbalance in our system in Minnesota that pays for community residential settings in a higher, or assisted living. It pays for provider controlled settings in an imbalanced way than people living in their home. And I know when you see the proposed budgets from several years ago, you still see that imbalance.
But we are actually setting the stage to correct that imbalance by, as Elise was saying, providing more resources to people living in their own home or family home, less resources to people in the provider control setting. We can't completely shift that at the start because it would completely disrupt our system. There are so many people who are accessing services in those provider control settings. So this is setting the stage, to start to see that shift.
Let me check my understanding. What I'm inferring from what you said, because a lot of people are concerned that the model is incentivizing congregate care. And if I'm hearing you correctly, what I'm hearing you say is you're hoping with the model going forward, that you're actually going to be making living at home easier and more incentivized than having to go to congregate care. Do I understand that?
Yes, that's right. And that was one of the original intentions of Waiver Reimagined. Also to put in the ability to limit growth in a provider control setting while continuing to allow growth. People who are accessing services in their own home or family. Can't currently do that, can't currently do that the way the waivers are structured.
Can you use real words on that for somebody like me who doesn't understand what the growth means? Just give a couple more sentences.
Sure, so right now we have, for disability waivers, we currently don't have a waiting list, people who need those services can access those services. I realize they can't always access services, people can be put on the waiver program when they qualify for those services. So in those programs currently, we either allow growth, allow more people to access it, or we don't. We can shut it off and get savings for the budget, or we allow people to access it. With the new structure, we would be able to limit growth on a residential support waiver. When I say limit growth, limiting the number of people accessing that program while continuing to allow more people to access the program and living in your own home or family. We can't do that right now because of the way that the waiver is structured.
So this new system will let you balance that use a little better. Okay. I know John said go. John, before you go, the last question I was going to ask everybody is if people in this room and online could remember one thing from your perspective, what would you want them to remember?
What I'm taking away from this is just that I need to learn and listen. That's what I'm taking away from this. Just know that I've heard feedback here today from a lot of folks, and I will be thinking about it, and I'm just going to continue to learn this. So, and we'll try to build together. Thank you.
John, thanks for being here. I'm going to let you leave and we're going to keep talking. Okay, and I also want to check on virtual.
Everybody else has spoken but me.
Oh, sorry.
Right there.
I keep going back to the virtual space. Sorry, Todd, thank you.
Sorry about that.
Good.
So, with all this, seeing what's already been decided, I think a lot of members here and the public kind of felt like, this is a train that's already on the tracks, trying to figure out what impacts we as an advisory committee or as a task force can make. And so, with that, we have our priorities as task force members, but also from DHS's perspective. So what specific policies or areas of Waiver Reimagined y'all envision us having the most impact on? Because knowing that we only have until March, we really got to figure out what to prioritize. For example, Dr. Kate had great comments about, rate exceptions or, exceptions in the process for authorization. So yeah, just real quick, if there are any, specific, areas of Waiver Reimagined that you envision us really be able to focus in on.
That's awesome. Areas to focus on.
Thanks, Chad. That's a very good question. And I'm speaking on putting both hats on as a task force member and also a DHS staff. I think this is a very good opportunity for us to work through exactly naming what it is, the exception process, right? That could be a priority of the task force that I can see as a immediate, like a concrete actions that we can co-create together for the exception process.
And I also think about so we have said that the January 1st, 2027 implementation date, that's when individual budgets will be implemented. That's when moving from the 4 waivers to the 2 waivers. I would really like this group to talk about what is the experience of people. So how do we get people ready for that date, or whatever that date's gonna be for them through the rolling calendar year? What do we need to make sure is in place so that people feel as prepared as possible for that transition?
Along those lines, one really kind of exciting part of the project is the individual IT portal that we're building. You know, health insurance companies have had for decades now the ability for you to look up your claims and to understand what services that you have, and for the first time ever, we'll have the ability to kind of the person to be in the driver's seat of their plan. And I think that's really exciting. And I think this group could really help inform how useful it is for people. So we'll roll it out, I think, in the summertime, but that will just be the initial rollout. So, you know, does this work for you? What else would be useful for you to know? Because I think the underpinning of this whole project is really to put the person in the driver's seat of their own plan, not the county worker, not DHS, not the provider, you. And that's a key tool to do that. So I'm excited about that part of the project, and I think it really should be driven by you all. Make it useful.
I want to honor our time constraints for public speaking. So I actually want to follow John's lead, that's okay. And for you I guess 2 questions, just really briefly. One is, what are you taking from this dialogue? And what would you hope people leave with as part of this dialogue?
I'm taking the importance of these types of conversations, this really being challenged and making sure that we're thinking through the things that we need to do. Hearing how people are interpreting things that we're saying is really important to hear. What was the second?
What would you like people to take away from?
That more and I members of this task force, we're going to be having these conversations, and we have thick skin, so we're ready to take into this.
For me, it's about, in addition to being the task force, this is new. I haven't been in previous waiver reimagined work group before, and I'm very honored to be here. I know that it's hard, and I want to be in the hard with all of you. And I just want to say we're all in this together, bring new perspective, and really trying to improve our system. And I really mean that from the bottom of my heart. And I'm here to listen.
I think one of the things that I'm taking from this conversation is that there is, and you know, this panel doesn't dissipate it, palpable and pent up anger in this community. And I can see that and feel that energy. And I think use that, having that awareness going forward is important, because I think we need a lot more conversation. So that's what I'm taking from this, is the need to continue to collaborate and you know, to just show up to these spaces. So I would love to have more opportunities to do this and to dedicate my time working more with all of you, building the trust and collaborating.
Yeah, I would agree exactly what Christy just said. You know, I felt honored that you even invited me here, because in my role, I don't get a lot of opportunity to hear from people besides at the legislature. And a lot of times those voices that you hear from are the loudest ones, the one who are paid to be there. And that's not who I want to hear from. I want to hear from, you know, real people Or I think as a mom too, I'm hearing like fear, and I would feel the same way. Like absent having my child's actual budget and knowing what will actually happen, I am skeptical and I will be fearful until I get that. And so I would be in that exact same chair as a mom. So I hear you and I feel you, and I hope that I can be invited back and work through the issues as we know more about the budgets especially.
Yeah.
I don't have, first of all, this would be up to them, but I would say that the more connected you are in this process, the stronger it's going to be. And so whether or not you're formally invited here, or you can usually screen it, or, and just sort of stay plugged in. And I also know that there's a lot going on in DHS right now, and that we weren't even sure people were going to be able to be here to get away. So the fact that you all were able to get away and dedicate this time is really appreciated. Before we sort of thank you with a small round of applause, I want to make sure that we capture the questions that are in the virtual space. So on our mat, they don't lose those. We want to capture any questions that we have at the task force and even the public. These are the kinds of things that you can put on those post-it notes and put in the general commentary so we know where people are. Like, just read it. And then you are welcome to stay as long as you want as part of the meeting, but we're going to take a little break now. And if you want to maybe meet people in the public space, I would invite you to do that. So if you join me in thanking the Legion representative for being here, really, really appreciating that. We're going to come back at quarter after the hour by that clock, which to me, if my math is correct, is about 12 minutes.
Well, I didn't to talk, and if you need a break, you can take it, but I wanted to say something while VHS was here, and one already had to leave, which does not show to me that you want to hear. I was part of the original Waiver Act and Advisory Committee, and we've been asking you to partner with us, with stakeholders, for years. In fact, we did it in front of Natasha Merz at the legislature, and we're completely ignored. Some of you were involved in, some of you weren't. I'm not saying that, but it shows me that you don't know what we're asking for when you sit up here and you say, we're gonna go develop this portal and we'll roll it out, and then we'll ask you what you think about it. How are we being partnered with in developing it and designing it? How are people with disabilities and their families and stakeholders being partnered with right now? This is not partnership. And it's got to change. You say there's action, but you don't really know when you want to hear it. We're here. We're ready. I've been, go back and read the meeting notes. I've made tons of suggestions. And for the point of facilitation, when I say I can't go on like this because you keep jumping around and you don't let us put a thing to bed or a timer on it, then you turn around and say, Katie, help me take a note because I'm going to lose track. That tells me that you think your facilitation is more important than my process that I need an accommodation for. And I guess I just didn't appreciate it.
I so appreciate your candor.
And there's lots of these up.
Yeah, and I forgot to take them over when people ask the question. Katie brought me like, I'm never even there.
We'll still have something to say.
And that's the case. And so this is going to be a challenge. In the same way that I asked to speak with candor, I appreciate your candor with this. And I will let folks know that my framing was based upon the feedback I reported out to you, which is there were a lot of people that wanted to have a voice. So I wanted to make sure that we sort of practice that. So thank you, Chad, for pointing out that because I didn't see your thing up. So I deeply appreciate that. Tell me how you want to use this time. Do you want to take a break and come back? After we come back from break, Tricia's got the floor to talk about the Tri-Charter report, but we can take the conversation wherever you want to go.
I don't want a break. Right now, I don't want a break. I just want one question answered.
Can I interrupt real quick? Can everyone continue to say their name for the folks virtually so we know who's
Thank you, Jenna Johnson.
Thank you so much.
If Janice needs are met in this interim period, she won't be able to keep her home. She will lose her home and have to go to a congregate living or an institution. And that's what's upsetting me so much is because, and a lot of other families, because we can't exist with 50% less of our budget right now that we're just getting by on. to make this waiver reimagined work, because she'll already, by the time you figure it out, she's already gonna be in a home that she doesn't wanna be, or an institution. So just think about that. We have to do something to protect the people that we've served.
So Cindy, just so I understand what you're asking for, you're asking for safeguards. Is that fair in, as it relates to the transition? Yeah.
Yes, because what we've seen, what you guys have shared with us, it shows that she will lose 50% of her support. If that happens, she can no longer live in her apartment where we're upstairs in our place to protect her and oversee.
And I will lose staff, and that is not okay with me.
So, the process is so important. I just want, whatever you do, don't hurt people. Don't make it worse.
And don't have anybody like lose staff, because I have Emma here and I don't want to lose her. She is one of my favorite people, and I don't.
Thank you, Jennifer. I have the list. We need safeguards regarding transitions. We need to make sure, 100%. That can be the work of the task force. Yep. What else? I really do want to give you a bio break at least. So the folks that are ready to take that, I really do. Can we just do maybe 10 minutes? Because we want to come back and want to get the board to switch up, to report out on the tri-care report, and then talk a little bit about that.
I do just want to say thank you so much, Jenna and Cindy. I really appreciate your passion and that strong message, and definitely it's heard. I do want to say that the numbers that are out there are based on the Oldham Places assessment, and that's what HSRI is working on now, is updating that information about what those budgets will be. And then also, we need to be thinking about the exception processes to make sure that exactly what you're saying. We do not want to disrupt people that have figured it out and have it working for you to be living in your home.
And from a task force strategy work perspective, it strikes me that this afternoon, if we do focus on those things that we want to have figured out before the CMS submission, that may inform what gets submitted. We have like a little bit of a window that maybe we can get that. So maybe the exception process or maybe the safeguard process is what we want to make sure, or this group wants to make sure is in the CMS submission. So we don't lose sight of that. Yeah. So that's part of our plan. And we're going to start putting these back up to speak, because that's what I'm thinking.
So I administer, some of the largest support groups, and the mid-choices support group, the appeals support group, the waiver remand support group. I help co-facilitate those support groups. So I have access to virtually tens of thousands of participants on a daily basis. When you mention the old min choices, are you referring to pre-min choices 2.0 revision? Okay, the new min choices is not helping people at all. I mean, we're seeing tremendous budget drops across the board.
So I'm hearing that as feedback to DHS. What role does the task force have as it relates to that? Because I'm just trying to keep track of our agenda, like what we're going to be working on.
It might not be, I don't know.
I don't know. Yeah, I was,
Exception.
I also don't know, but this is something that we can think through.
So let me put this in.
Can I?
Yeah, I want to put on the parking lot too, so we look back around with Kate.
Yeah, I'm just trying to understand the question. And to me, who knows nothing about MinChoices, how do we know if MinChoices is working or not? What's the like criteria that we use? You know, and so maybe that's a question, maybe that's what we have, maybe that's what we have to figure out.
If it's not working, do you want to know, or are you just gonna move ahead anyway? I think that's how we feel.
Sure. And we want to know. So MinChoices, just from my understanding, MinChoices 2.0 was rolled out. And we didn't have the time to really do the, making sure, doing the testing, right, for validity and reliability. And that is something that we are putting into work to do in the upcoming future very soon. Yeah, so. I don't think I know anything else.
I want to be candid because it's not that we, like Maura said, not that we don't want to know, but I think MinChoices, as John mentioned, is the vehicle that we have right now to meet the timelines. And so I don't think that we can change. I think that that's something that can be changed in the immediate. Like Maura said, it's something that we're trying to work on, but I want to be honest with you.
And I think I followed up when John was here and I said, but maybe at some point in the future, right? In fact, oh yeah, it could have changed signed by MinChoices. So I'm going to infer, based upon what you're saying, that changes to MinChoices would be out at least a year. Is that a fair?
Yeah, timeline, human life.
Yeah, as John said when he was here, we don't have any flexibility on that date. The legislature is the only entity that can move the date.
So let's go together. DHS and stakeholders, let's go demand that they do something, because I'm sorry, people are going to die if we don't pay attention to this. Health outcomes are not good in institutions, we know this.
Yeah.
People like Dr. Kate, it's not gonna happen. There's not going to be like to see.
Okay, so we got a bunch of people talking. That's okay.
And it's not just the participant. When you are relying on family care, and I'm 73 years old and have some chronic health conditions, and I am her only spouse. That's not okay. And it's because there's staffing shortages and PCA can't do the care that she needs. And when you start talking about her losing $100,000 out of her budget, with current things, that's not sustainable.
So as I'm listening to you all, what I'm thinking about is what I'm thinking that what we're going to need to figure out collectively is how to surface these risk areas in like concrete ways in the next 3 months or 2 months, so that any changes that would be getting submitted to the Center for Medicaid and Medicare for the suggested upgrades to the plan are factored in that way, and that you're not submitting to CMS a plan that has those gaps without safeguards in place. Is that fair from the DHS perspective? Is that fair from a task force perspective? Am I getting that sort of picture right? Like, if we can collectively identify the holes and figure out the safeguards before the submission date, does that feel like the right kind of focus? I'm seeing a nod. Tricia, does that land for you?
Yeah, it's a start, critical conversations at a critical point.
Yeah, yeah.
Establish trust around that, because we have been. How do we establish trust around this? Because we have been voicing this since before MinChoice 2.0 came out. We're like, then we were told, suck it up, it comes out. I met with Natasha Mers, asked where the inter-rater reliability was. She didn't know the definition of that, then admitted it didn't exist. This is the equivalent in my mind of a factory that builds vehicles that we know the part doesn't work, but we're still manufacturing the car, even though we know it's going to crash and people are going to die. So what's the acceptable number? 5%, 10%? What's the death rate that's acceptable to you? Because to me, it's 0. But your actions don't match the words.
Yeah, I think this question about how do we restore trust, or even the attempt to restore trust, is a really pivotal one at this phase. And Katie, I'll be interested in you weighing in. My experience in working in these kinds of situations is it isn't that I trust you. It's that we have an agreed upon process and how this is going to work, and we're buying in and being faithful and having fidelity to the process that we co-created and move forward together. And I think this touches a bit on Trish's concern about, we don't know how to work together. We don't know how to work together effectively. And so in my work, I don't try to help people trust each other, because people can make their own choices about who they're going to trust and respect. But if we can agree on how we are going to work together from a process perspective, then that is the bridge. That's how I lean. Katie, do you have thoughts on that?
My thoughts on trust. So first of all, we're historically in the world in a very low trust environment. There's a deficit of trust in our world right now. Then we are in a particular issue area and sector where there is even more low trust and historic low trust with DHS, with human services at multiple levels. And rebuilding trust in this environment is very, very difficult. It's not something that happens overnight. When I talk about trust, I steal analogy from Brene Brown. She has the marble jar. I didn't bring my marble jar today, but I should. Do you know the marble jar? Yeah. So trust is like a marble, right? You build it in small ways, and each time that something is followed through on, that email is responded to, you agree on that one task together, and it might be a very small task, a little marble, but it gets done, and it gets done the way you agreed upon, that you can put another marble in the jar. So one of the things I would suggest is here in this space, there is an opportunity to start choosing some marbles to put in the jar one at a time. It does not mean you're still going to have that empty jar of mistrust. That's going to be there, and that's real. But there also has to be a conscious choice to say, I will take the risk and the leap together to work to put that one more marble in. So that's my perspective.
No, but it's really about, like, I took a risk in trusting you and you delivered on that. And I think what this is a variation on is that we are, one of the task force members said to me that it's really important to be precise with our language, right? And that we agree on what important words mean. I also believe the same thing about expectations. Just because people have an expectation of a task force member or an expectation of a DHS staff person, doesn't mean they agree to it. And I have a story from when I was married that blew up, and I learned that lesson the hard way. So one of the things that I'm going to try to be faithful to in our process is that if there's an expectation, that we surface it. And often we don't realize that we had an expectation of someone or something until they've pissed us off. And instead of using our pissed offness as a reason to go at them, the first question I tend to ask is, did I have an expectation, and did I have their agreement on that expectation? Because if I didn't, then I'm just like vomiting my expectations all over people and getting pissed off, but we never had a deal. So part of, I think, our work is being abundantly clear on what we're asking of each other and what we're saying we can agree to in this process. And we have to give people space to say, I hear you that you're asking for that, but I am not capable of doing that. It's not within my span of authority, or it's not within my decision space, because the decisions on what is decided here happened at a didn't happen in DHS. So as we are working, this is all under the banner of trust, as we are working together in building trust, one of the things I'm going to ask for is, can we move forward without blame? Because blame in systems and in relationships is a toxin, and it keeps the distrust going. That's not asking you to live in fantasy land. But it's to say, okay, we have a choice at this moment to proceed in a new way. And that's a choice we're gonna have to make. I think there's a great opportunity ahead. But come on, Dr. Kate, let me go to virtual space because we've had a lot of time here. Virtual space, what do you got going on, Matt?
We have a lot of questions, but these, I don't know if you want to continue fielding them, or I've got them all captured so we can answer them later if you would prefer.
I think capturing them is great. Is there anything that feels sort of thematically relevant that you want to raise up?
I would encourage everyone just to speak up. The microphone, it appears that it picks up your audio. If you're a little bit quiet, there's a faint buzzing that we're picking up, but when you are projecting, everyone sounds great. And then I know it can be a hassle in that physical space to say your name each and every time, but it sure does benefit us in the virtual space. That way we can start to associate names and voices.
Thank you for that reminder, Matt, and thank you, virtual folks, for hanging in there. That way, I am passing the phone to Dr. Kate.
I don't like the use of trust. I can give a part of me, and when you scream them, it feels like I'm throwing away part of me. I prefer to use the phrase most reliable because that allows for occasional screenness without losing relationships.
I don't like the use of trust, because if I trust you, I give you part of me, and when you screw up, it feels like you are throwing away part of me. I prefer to use the phrase mostly reliable, because that allows for occasional screw ups without losing relationships.
Awesome, green card on that. Thank you. Okay, perfect. Katrina.
So budgets are part of this. But I would like to know how DHS determines compliance when budgets technically authorize nursing or home care, but there are no providers available to deliver those services. In other words, how does DHS reconcile the reality that the federal requirement is that services must be meaningfully available and not just theoretically covered? And I say this because it's my understanding that HSRI was not even aware that we have a nursing desert. You cannot even start a plan without this kind of information.
And Julie, I just saw your thing. I'll come to you next.
You might have to take it back. Yeah.
Speak, what are the words you're talking here so they know?
Oh, I'm not sure that
Your
I
name,
fully-
you
My
are.
name is Christy. Hi, sorry. I'm not sure that I fully understand your question and I want to hear more. But one thing that I do want to lift up is we worked with the legislature last session to move the nursing out of the budgets, or was it back in? I'm aware of that, or there were complaints.
It was an exception. It's like, oh, we're making an exception.
Okay, we're making an exception.
Exception.
I'm not explaining this well, but we heard from the Waiver Reimagine previous bodies that that was a major concern. We heard from others in the audience here at the legislature. So we did try to change that. I'm not sure that that's getting at your full question though.
Well, nursing is just a part of the shortages. I know families that have gone 15 years without a support person coming into their home, and now we have a moratorium on 245D licenses. And they're saying it's because we have too many licenses out there. But again, we have suppressed utilization, so we're tracking suppressed access instead of actual need. People don't have staff. We don't, the federal law requires access to these services and not just theoretical design.
question was just really the question in terms of the research that contractors had done, in terms of not really understanding completely the landscape of Minnesota from a professional provision perspective. Did I get that right? Okay, so, I would keep it down because I think it's a little short. This question about the picture of the landscape as it relates to the HFR. Let's keep that in the back of our mind topic. And then I've got Lisa, so I've got Julie and then Lisa.
Hello, my name is Julie Johnson. I wanted to ask this question before Christy left. We have a lot of places where we all disagree and want to bring into where maybe we're in agreement a little bit. And we're in agreement that I heard you guys say that at the legislature, you were in support of getting more time because you didn't feel like we had enough time. This task force has acknowledged that we want to do a report early because we have to get something done early. Is there a possibility that this task force and DHS together can go to the legislature and say, we agree to. And is there a chance that they will listen to that because session doesn't start until this? So how can we do this? How can we agree there? Let's lead into where we agree.
And then also give them space because you also report through the executive branch. And so what you can and can't do may be somewhat informed by who you report to.
This is Christy, and that is true, Fran, and I appreciate the sentiment, Julie. I don't know that we can do that as DHS because what we bring forward has to be approved by people that supervise me, and people that supervise them, and the governor's office.
Let's go to them first.
And I what I could commit to is going to my boss and going to the commissioner and saying that we would support a delay. But I have to be honest, I don't know if it's the red card or what, I don't think that that's gonna happen.
Either you wouldn't recommend it or that it's gonna be accepted.
I don't think it will be accepted by the executive, but also by the legislature, because the legislature had an opportunity to pause it last session and they chose not to.
And I agree with that, but.
Hang on a sec.
That's why I asked that question, because I know it's a really hard question to ask. However, what I have heard and what I've heard from legislators and just when they describe waiver requirement and when they got the task force would be, I don't think it's in alignment with what's already been decided. And I don't think everybody who's making decisions here, which is always true, legislature, right? There's a lot of things they need to know. But I don't think we're in alignment about what's been decided, and they think that they've passed something that's not gonna happen. So I think as a task force member, I would commit my time to going to the governor, to going to the legislature to say, we know we didn't delay it, but it's not working. So we're gonna roll it out and have one thing that everybody's gonna be unhappy about. It's not that, right?
Fran, just a quick technical thing.
Yeah.
It seems that mic is not coming through well. That mic seems to be going okay.
Okay.
So
Okay, so we'll be a one mic house. And Katie, when I was just gesturing for you to sort of jot something down, what I'm wondering is whether or not part of what we look at is how can we check for alignment between what was legislative intent and kind of where we've ended up.
is that mic on?
I think that might be
Oh.
on mute.
Well, that's why it's not working either. There's a mute button too. So just for folks that didn't hear it, like maybe what we have on our radar is how do we make sure that we are working in alignment, that what was initially intended has drifted. And this may be something that doesn't involve DHS because of the nature of your reporting structures. This may be something that falls heavily into the task force. But if we can just like flag that, Julie, did I capture the spirit of it? Okay, please hold on a second. I want to see if there's virtual. Matt, I see your hand. Is there something to add on there?
No, we're very thankful for the additional audio help. So it's coming through better now.
Yeah, thanks for letting us know. Lisa, and introduce yourself again, please.
Yeah, thank you. Lisa Harrison-Haller, I'm the Ombudsman for Mental Health and Developmental Disabilities. I do want to just thank all the task force members as well as DHS. I think these are great questions and kind of an entry point into some of what will be difficult, but hopefully very productive conversations. Without echoing things that have already been asked, I do want to point out, I think that part of this work as we go forward, thinking about waiver reimagined needs to consider our state supervised county administered system and just the deep inequities we see behind counties that do comply with recommended guidance from the department and when they perhaps are a bit astray in some of the implementation and how we can be really proactive. I think that gets tangled up a little bit into the Min-Trace's 2.0 conversation, as well as just broader access and equity issues. And it's been our experience at the Ombudsman's office that state supervision piece isn't quite accurate in terms of being able to provide technical assistance that may or may not be accepted by the counties and wanting to really think through with any kind of transformational change in the system that we're doing so in a way that's forward thinking to prevent those potential pitfalls as much as we can.
I saw a lot of nods with the DHS staff. Does anybody want to put words to your nod?
Say your name again.
I mean,
Who are you?
Oh, Elise Bailey, Budget Director. 100% agree with everything you said. I think, mentioned it earlier, but like the goal of all of this is to actually take out all the variability at the county level and put people in the driver's seat. And that's kind of the crux of a lot of challenges we've had. Counties do a lot of great work, but it does mean that, the success I have as a mom really depends on what worker I have and where I live and how much I personally understand what's available under the workers or whatever plan that I'm trying to plan for my child or if it were me myself. I should need a PhD in DHS speak to make sure my kid gets what they need. And so that's exactly what we want to do, and it definitely needs to be at the forefront. I would also say that conversation is happening all over the place. What should the role be? And what should the role be of the state? And all of these challenges that we're experiencing right now at DHS, whether it be the state budget, whether it be program integrity, whether it be this project, I mean, it's all over the place. This is one key thing everyone's talking about. If we were to build this system today, how would we build it? And what should our role be at DHS and what should the counties? And that should be maybe something to kind of talk about here.
Say the question again, then what am I written down?
Oh. I think you, Lisa originally said, make sure to I don't understand.
I was inequities across counties.
Yeah.
I wrote down inequities across counties. Does that capture the spirit of on our radar?
If I may just kind of elevate a quote from my predecessor, Roberta Opheim, who was our ombudsman for decades here in Minnesota, used to famously say that right now we have a situation where geography is destiny in Minnesota in terms of people's ability to access the services and supports that they need and wanting to be forward thinking and intentional about trying to resolve that from the creation of rollout as opposed to after the fact.
Who are you?
I'm Christy, and I just want to lift up one thing you said, Lisa, that I heard that I don't think I don't have an answer for. It's not just, well, how do we make sure counties don't have bias or, inequity, but it's also as a state, what are we doing to hold counties accountable to what we want? And that has been a really challenging policy that we haven't figured out how to do that. There's been ideas that providers have put out, should we fine counties if they don't do something right? And maybe, and then counties, of course, have fought back, but we don't have collectively a good answer to that, I feel, and that's on us. So we need to put our heads together, and if you guys have ideas, I think bring them to us as well.
I want to, I want to respectfully challenge something you said. I think there's probably muscle memory in DHS that says, yeah, that's for us to do. And I think there's probably good intent there, okay? But I hear this body saying, we need to do it together. So instead of saying, and the muscle memory just being aware of saying it's for us to do, what I'm going to invite is for you all to reframe it in your heads to say, how might we engage the task force on this? how might the task force help? Right? Because I think our brains are so fast, and that's what muscle memory is. And there's an opportunity to put a little speed bump on that and to say, if we're committed to working differently together going forward, that is first going to start by thinking about the problem differently. Right? And I also get, like, if you all have deadlines to meet, the expectation of the task force would be you have to keep up with the pace that we are expected. Like, the task force can't slow us down. So how do we do it in a way that hits these deadlines, right? And lets us all be successful. But I hear that periodically, like, this is on us, or this, let's disrupt that. Virtual space, you got anything for us?
No new questions. I think just some of our questions, I would like to go back and address one that I do feel is important. There was a data point brought up by Elise earlier where people were living in congregated settings. That budget is about 70% higher. And the question is, what steps are being taken to ensure that those numbers are accurate other than simple cost reporting?
Thank you, Arden.
Hi, this is Elise. That is basically the total amount we spend in claims. We spend about 75% more for a service plan in the congregate or provider controlled setting on average, you know, it varies, than somebody living. So that is the claims, and how the claims are determined are the legislature sets the rates. So residential rates are set at X, you know, and services in a person's own home are set at Y, you know, it's complex. But DHS doesn't have authority to set those rates. The legislature has set those rates. And then, of course, the other variable is how many services a person gets. So, but on total, in a person's when they live in their own home on average, they cost much less than in a provider controlled setting.
Okay. I need to slow this down for my level. I'm imagining you have a sample case of somebody who has, let's say, complex medical needs, living at home, and a similar kind of case, a comparable case of somebody with complex medical needs living in congregate care. And it's the comparison of the two that starts to reveal that difference. Is that a fair sort of simplification of the process?
Thank you, Fran. This is Elise. Actually, I would say the opposite. When I talk about 75% more, I'm talking about statewide, you know, the thousands and thousands and thousands of people that we serve, aggregated. So that person with really complex care needs in their own home, they may very well have service needs that cost more in their own home than if we were to serve them in a provider controlled setting where there's shared staffing, for example. And that is why we need an exceptions process, right? That is why we can't ever meet every single person's needs through a model. And we know that. So thank you for asking the question. That's on the aggregate.
Okay, thank you. And I just want to note this exception process, because I'm new to the dance floor here, is one of the bullet points that is expected of the task force as defined in the legislation as I've seen it. So it's called out there. Okay, please.
Can I make a quick comment before I ask a question?
Yeah.
Just quickly, so a 75% differential would be about 4x. I'm aware of at least 7 other states that have received federal injunctions for following a similar and the same contractor, similar timeline and model. In those states, they were enjoined for having differentials of between 1.5 to 3x. So Minnesota's differentials are unprecedented.
You're using jargon that I'm not sure everybody knows. Can you explain differentials and what your 1x and 2x mean?
The rate difference between residential versus individual budgets is unprecedented. And other states have received injunctions and they've been enjoined for having anywhere between a 1.5 to a 3x difference in their budgets. So that was the first part. The second part is, I noticed, I don't think anyone from HSRI is here today. Has the state or DHS received and accepted their deliverables already?
Where do we stand on that?
This is Heidi. On your the first point you made, I just want to address that. That 4X, it's not a state set budget. We don't say you get this amount and you get this amount. That's what we've been talking about, is that variability across counties. And what Elise is referring to is the paid claims, which is one of the reasons why we need to do a state set budget methodology so that we can have more control over that. I agree, that's unacceptable. Related to the HSRI deliverables, it's an ongoing contract, so we have received some of their deliverables, but are still in the process of receiving others. Is there specific ones that you're wondering about?
The model, the design.
We have that again.
Katrine's really specifically asking about the model, and we have not received that yet. We are in ongoing conversations with them, answering questions so that that helps inform that work.
Oh, Trisha.
This is Trisha. So I wanted to address the differential, you have a higher budget because the services that are being billed for in congregate care are being billed for at a higher rate. When I keep my child in our own home, I don't get to bill for the rate that I set. And to say that the legislators are the ones setting it, we know they're not informed on this. They don't know the reality of it. So who's informing the legislators on what these budgets should be? Who are they listening to? And I think that's a question, if we went together, we would have a stronger voice.
I just want to capture that. We have a question that the task force considers, which is how best to inform the legislature.
Okay,
Right?
yes.
Like it's an action item.
Right, and I hear you when you say that it's probably not likely that if we go to the governor and we go to the bodies that have the power to put a hold on this, I hear you. It's gonna cost a lot of money to do that. Human life and people with disabilities should not be paying the price. It just shouldn't happen this way. And we have a hard time, I think, getting in front of the decision makers to even say it to my face. Tell me that my child's life is not as important as your balanced budget. And so, it's not unheard of, because with the Real ID, how much did it cost to stop that process and slow down and get it right? So just one example, and I think if we do it together, it would maybe have more impact or likelihood of impact. And I think we just need to put it this way too. If we don't do it right, if you don't pause it now, you are asking for more fraud. Because there are people in congregate care settings right now that are billing for services they're not receiving. Either there's staffing shortages or whatever. But part of what they're billing for is helping a person bathe every so often, and it's not happening. That's where some of that fraud could be called out or avoided. There's nothing we can do now, but let's move forward and we can talk about that by having critical conversations at the design. So if there's something that we can influence now, we want to have that. Let's talk about it, because in the end, I think we all want the same thing.
Thanks, Trisha. I think that framing these as questions like how might we be able to influence the legislature? How can we best do that, right? And if DHS is not able to actually represent, right, maybe your role is to help educate us, the task force here, in terms of what messages land, how to be effective in that way, what are going to be the kinds of questions, so that we can be there together, aligned in spirit. Even if you all can't advocate that way like that. Yeah, that's the nature of a hierarchical system, unfortunately. Do I see other? Okay, Dr. Kate.
This comes from previous question.
It has been best practice that money should follow the person. Current HSR council has the person following the money. The budget's own person and why they describe them when they are based on their own person lives, which suggests that the waiver money is subsidizing congregate care and not allocating money based on the person's needs. Current emphasis on combating fraud. This seems like a potential area of concern. There seems to be an assumption that people living in their homes will receive uncompensated care from their families, which does not seem to be a reasonable ethical stance, as it can negatively impact families. What is your justification for using budget ranges based on where a person lives and not on their needs when this raises so many issues? Long term.
Yeah, you said it fine.
Thank you, Dr. Kate. So first is, Dr. Kate, could you please make sure that you email those questions so we get them? Instead of asking, if you allow me, instead of asking the question, like to have it be how to justify it, I'm wondering if there's an action-oriented question that we could have there, which is, how can we explore this with more rigor? Like, how can we understand this better? Because in the spirit of trying to build trust.
It has been best practice that
Okay.
money.
Okay, I think your mom's telling you to be quiet. I'm sure you have something to say about that one.
I hit the wrong key for her. I can talk about that. One of the things Kate has suggested over and over and over again, that budgets based on people's need be consistent no matter where a person lives. And if congregate care needs extra funding, that is separated out so people know how much is going to the congregate care facility. And how is that money that's being in a person's budget, how is that money being used within the congregate care facility? As opposed to saying congregate care is getting X. How is it being used? How do you structure that out? Kate's on a CDCS waiver, CAC waiver, and I have to list out all of the systems and how much is being used, and it has to be verified. Why are congregate care facilities also having to list those things out so people understand in the general public, oh, these are needs, these are how congregate care is meeting those needs. This is how congregate care pays for electricity.
But to break it down further, if I may, it costs more to go into the congregate care, but is that money going proportionately to the individual providing the care? Because we know we have a staffing problem because we can't pay those workers enough. Where's the money going? Who's making money off of it if it's costing that much?
So I think that what I am observing is the system is so complex and so decentralized and so many moving parts that when we do our list of questions, and I'll tell you why the questions matter. I think one of the things this is to the task force, are going to want to strategize over is what are the right questions at the right time in the right way so we can plan our work. Because I feel like there's so many questions and concerns that we could be so completely overwhelmed by all of that, that we're strategic in where are our lever points and what's our best way to get those things answered. And I see you, Chris. I want to let the task force know, I want to let the virtual space know, and then I sort of want to let the general public know. that being able to frame questions that are like, how might we, or what if we tried, is the way for somebody like me to help build out a meeting plan. And because questions are actionable. And I'm a big believer that a complaint is just a poorly worded request. And if you can give it to me in a way that I can take it as a request, we can work with it.
This is Chris again. So I'm professionally a nurse, long, old nurse. And then I'm also a mom of a kiddo with disabilities. So I have a foot on either side, other than I'm not disabled, my child is. So I'm looking at it from the lens of a mom. As a nurse, we go to where the work is done when we need to make decisions about how to improve the care. We don't make tabletop decisions. So as a nurse, if I want to determine the root cause of why somebody fell, do you think I'm going to get that answer by looking at the incident report on my desk? Or could I go to the resident's room and talk with the people who are the actual experts and the resident to determine the root cause? So I say all of that. As a nurse, I harvest an enormous amount of data. As a home care provider for my child, I put in a ton of data. Where does that data go? It's not going to make decisions. It's just merely paper compliance. I get that because I need to show the work that's being done. Here's a huge opportunity to harvest all of that data that we're all putting in the healthcare systems. So in a nursing home, I'm putting in MDS data. That goes to CMS. That's how the reimbursement's driven. You have a mid-choice assessor who comes out to do that assessment, and they're putting in sometimes garbage in, garbage out. We know that because we see the budgets go down. We're not seeing the methodology to reflect the person-centered care. What if we just thought outside the box? We went to where the work was done and we harvested the data that's already existing, that's already built in there. And we created the budgets based on what the people need, not what I hear you saying, what was actually utilized, because Katrina hit the nail right on the head, and Dr. Kate did as well. Like, we don't have our providers. Jenna hit the nail on the head. We're gonna lose our staff. What if we went to where the work was done? I invite you all over to my house to see how the work is done. And I think most of us in this room would extend that opportunity. Please come see where the work is done to make those decisions. You have a standing invitation, 16637 Piper Lane in Braden.
That went out, you know, to the entire.
I'm married, we're very happily married.
My vote hadn't gone there, but thanks for adding that. There's something about ground truthing it. Yeah. So I'm trying to catch them on the flip charts. Folks want to weigh in on that? Christie's like, I know Elise is like, do I want that next?
I just have to say, I love this conversation. I mean, amazing ideas. And the ideation of like what could be, to me, that's, my heart is singing, even though this is a challenging time. And so I appreciate you coming to the table and saying, hey, let's think about it a different way. And so my brain is kind of spinning, and I love that feeling. So just want to rejoice in having that moment. Trust me.
Sorry to get your names confused. Matt, what's happening in the virtual space?
Right now, we've got a lot of listening and one other question that has not yet been addressed. So if, it's a great question that came from Jennifer. How can someone move from congregate living when home modifications and assisted technology cannot be completed? So, or with emphasis on double billing. So right now, you have to be home for these modifications to happen, leaving individuals in an unsafe setting. So how can we get people back home and keep them home?
Okay, I'm tempted because this is a very concrete operational question, which I think is very important. And if we can capture that, because I'm kind of hoping that this afternoon we'll talk about ways that we can ground truth some of these experiences.
Sure.
And that might be the kind of case that we consider and we process through the plan to say, oh, what's going to happen here? So we can kind of dry run it before the system's live. So can I get, are you okay with that? So with Julie, Julie, are you okay with that?
Maybe not.
Jennifer.
Oh, Jennifer, sorry. Jennifer, are you okay if we take that as a possible case? I think you and I talked about some of that before.
Yep, that's fine with me.
Okay, thank you. I appreciate that. Is it clear?
We would like to know how you developed the new budget methodology.
Katie, can you write that down as one of our questions?
Yeah. Great. I think I referred to that as a logic model. Oh, sorry, Jenna. Jenna and Cindy. So separate questions or the same?
No, we're kind of together.
Okay, I didn't know this was like an art installation. Who's taking the mic?
This is Cindy, speaking with Jenna, and we invited Governor Walz over when all this stuff started, and I've continued to reach out and give the invitation, never heard a word. I think if some of those legislators and the governor could come to our house or like to Chris's house and see the wonderful work we're doing and the wonderful life she has. That's what I want to share with people. That would cost more in a group home and way, way more in an institution. They may be more apt to listen to us. Right? Yeah.
Thank you. I think that one of the things we get caught in here is the difference of quantitative data versus qualitative data. And I think that quantitative data is often given primacy because qualitative data is often kind of like messier to handle or we don't know how to do it, right? And so what I'm really hearing folks say is we want to make sure that our qualitative data has the same sort of merit as the quantitative data, that we need to do that sort of in balance. Is that a reasonable interpretation? Like, let's not just have it be the quantitative, but it's part of that.
And that it gets to the right people.
Yeah, and making sure it's getting to the right people. I think that's true too. Okay.
That mostly reliable that Dr.
Hannah
said. I think, this is Chris, and I think adding what Dr. Kate said, that mostly reliable into our relationships instead of that on-off, black-white, like switch on-off of trust, not trust. That mostly reliable is such a brilliant point to bring to that qualitative data. If you allow us to exhibit that and you glean that information, we want it to be mostly reliable. We don't want to just take up 6 hours of your time showing our lives and then say, well, how I know.
What stood out for me was when you said, when you allow us, and I get it. But what went on in my head is how does the task force take ownership? Right, totally, right. But we have technology now, like we've got video cameras, everybody's a filmmaker, right? And so particularly when we've got rural situations, we may be able to collect a lot of really valuable qualitative data in a systemic way that allows people to, yeah, I think, but I don't necessarily want to just give it to DHS that says, if you allow us, like, we're the task force. Like, we're saying that this is important.
When you come over.
Right?
We will show you.
Okay, when you come over, we will show you. Okay, got it. What else? Okay, then I'm going to take the pause and harness the pause. We are about 15 minutes early, but I'm just thinking it's really a good time for a break. And so the plan had been for the task force to break for lunch at quarter after. So we're going to have an hour and 15-minute break so that we let the published information about returning at 1:15 hold true. And so in a minute, I'm going to be muting the owl so that you're not listening to our chatter, and putting a slide up that says we're coming back at 1:15. Is your hand up or are you just adjusting your hair?
Well,
My colleague and co-facilitator Katie Pratt is adjusting her hair. I am a keen observer of things, and well, she had a question. Let me ask you this. I just need a temperature check on this. Red, green, or yellow? Does this conversation feel different than how you've engaged in the past? Red, green, or yellow? Does this feel different? And what color are you? Heidi?
Green.
Heidi's green, Moore's a green. Oh, sorry, I just told you your color. Okay.
I demand it.
Moore's green. Okay, so I'm seeing yellows and greens. Okay, how about in the virtual space map?
We're feeling yellow.
Okay, perfect. Let me tell you the meaning I make of that and take in the temperature of the group, and that is, this is moving in a desired direction. We're not there yet, but that it feels a little different. Is that a fair interpretation? Okay, so now we know what it feels like to move in that direction, and so we're in it together to keep moving in that direction. Would you please join me in maybe a little more energized, at least thank you for these folks for being here, fielding the questions.
Give me a